Hi, I'm Michael Buckingham. I'm a chiropractor here in Charlotte, North Carolina, and I want to talk to you a little bit about how the changing insurance game is affecting chiropractors. First of all, I've been in practice for about 20 years in private practice. One of the reasons I got into private practice is because my father, he's a GP, great physician, but he worked for an HMO in California for about 3 or 4 decades. And eventually got a great job as the chief of staff of one of the University of Iowa hospitals. But before then, he would constantly complain about how the HMO administration was constantly limiting the tests he could run, limiting the treatments. They're constantly increasing patient load on his schedule, which of course detracted from patient care. And taking that experience, I thought about it. I'm like thinking, okay, private practice is the way to go. Well, full circle, now we're dealing with insurance changes that, in essence, are very similar to those HMO limitations. They are constantly changing regulations, trying to deny treatment. It used to be in the past where you can code sprain strain, and they would give a letter or a call to the patient, basically asking if it was on the job or if it was in a car accident, and so they're trying to deny the claim that way. Now they're much more sophisticated. They are requiring very specific codes that if you don't get in the right order, then they will give you a denial, basically. They are trying to look at homeowners. They're trying to look at every aspect possible to try to deny the claim for the patient. It's so bad where you can't even code idiopathic cervicalgia or lumbago anymore, low back or neck pain. It has to be a specific origin. So as if all of a sudden idiopathic cervicalgia doesn't exist now. So they've completely denied those codes, and it's gotten to where even where if you use a neurological code for a neurological condition like radiculopathy, it has to be in a certain spot. It can't be a secondary code, it has to be tertiary. So they've set all these random and arbitrary rules and regulations to try to deny codes for chiropractors. Now, it's affecting a lot of doctors in that they have to take time away from their patients. I run a very patient-centered practice. We do all kinds of physical modalities, physiotherapy, acupuncture, dry needling, laser. Luckily, I have a great staff, and they spend a lot of their time during the day dealing with these changes. And in talking to other doctors and in recent seminars, a lot of these doctors are completely confused. There's chaos and confusion. So much so where a lot of physicians are now throwing their hands up and just saying, okay, we'll go to cash practice. So I don't really see the insurance game getting better. In my 20 years, it's gotten more and more restrictive. And now it's at the point where some of these changes aren't even for medical reasons. It's kind of arbitrary, only to make it more difficult. So that's my take on where we're going with the insurance game. And thanks for listening.